So today we are discussing prevention of occupational disease and injuries. All right, so some of this information that we're going to be presenting is going to be repetitive, so it's okay, no issue with that, because at the end is we want to re-emphasize issues that are important. KQD 7003, occupational and environmental health in engineering. So good morning again, everybody. So if you are okay, so I can continue with my class. So we know that there are 3 different types of diseases that you can see in the workplace, like general diseases like diabetes, hypertension, cardiovascular disease, hypercholesterolemia, asthma, or any other kind of diseases. So the issue that you can see different type of diseases in the workplace is important for you to understand, as you all will be dealing with people, and people have many problems, and all these, we know that all these diseases in the workplace can affect work and can affect how they perform, so can affect work and performance of the workers in the workplace. Of course, we have another type of disease in the workplace, which is called work-related disease. I think this one has been explained clearly by Professor Dr. Mansuki Isaha. All right, so what are work-related diseases? Work-related diseases are any diseases that occur in the workplace due to exposure to hazard in the workplace. All right. So work-related diseases can be further classified into work-aggravated disease and occupational disease. So the idea of work-aggravated disease is that when you have a diseases that is present in the workplace, present at home before you can develop the disease, and then when you go to work, the disease gets worse, then you can consider as work-aggravated disease. And occupational disease are diseases that, because solely due to exposure to the hazard in the workplace, you develop occupational diseases. This is a simple representation of chronology of event and timeline. I think this one Prof. Azuki also have discussed with you earlier. So when you started work and the symptom develop, then you basically can consider yourself to have occupational diseases. But of course, not all started work and symptom develop, you get occupational diseases. You have to rule out what other kind of diseases or things like that. But generally, if you think that you started work and symptom develop, you can consider them as occupational disease. The reason for differentiating between occupational disease and work-related disease is solely, and most of the time, is concerned with compensation and not with how you manage the disease. How you manage the diseases is the same, but of course, if you have people coming in with earlier symptom and sign and started work, you as the safety and health officer need to identify whether the work itself would basically make the symptom worse or not. And this is basically is called work-aggravated diseases. So usually the doctor work start at the end of the when the patient comes to the clinic, and then when they see the symptom, this is why they call work-aggravated disease. But in the context of a safety and health officer, you need to basically be able to identify early whether there are symptoms, there are issues that are related to, they may be caused by work, or the workers may get aggravated because of exposure to workplace. That's why understanding all the chemicals or the hazards in the workplace is important. Then you basically will know that what the hazard and what the risk of developing certain symptom, and what is different hazard have when related to different symptom. So work-aggravated disease also can basically look at different jobs, and sometimes your work-aggravated disease does not occur straight away. It can look at occupational disease does not occur straight away. It can basically come after 1 or 2 jobs, or basically even you can have second job or third job. So understanding different jobs and exposure is also important in that context of whether the work or occupational disease arise from your workplace or from other workplaces earlier, that basically now he has become worse and basically aggravated it based on exposure currently. So those are the issues that we talk about: work-aggravated diseases or work-related diseases, which is divided into work-aggravated diseases and also occupational diseases. So definition of work-related disease, disease that occur among workers exposed to occupational hazard at the workplace. So work-related disease, there's two issue. There's two main issue here. Is basically it has to be among workers, and it has to be they have to identify a hazard in the workplace. So this is important for you to understand, because hazard, we know that there's different type of hazard in the workplace, and this basically will lead to different type of uh, workers being exposed to different type of hazard. And occupational disease, definition of occupational disease are diseases that occur exclusively among workers exposed to occupational hazard at the workplace. So occupational disease, some diseases are basically particularly more concerned with occupational disease, like occupational like asbestosis or silicosis, which basically does not actually happen when you look at it from the environmental perspective. Although in the environment you can get exposure to asbestos, exposure to silica, but the amount of dust exposed to for people to have silicosis, amount of people who are exposed to silica dust in the environment is basically very low. Even though, let's say you're staying in a, what we call in a desert where there's a lot of dust, that also the risk of developing silicosis among these people also is very low. So why prevention? So basically, the important thing is, why do we want to prevent diseases? So anyone, why do you want to prevent diseases? We know that currently, I think all of you are very concerned about the COVID-19 pandemic, which is basically still going on, and the issue of, if you don't prevent COVID-19 pandemic in your workplace, you would your work basically will be disrupted, and your profit would be go down, and and the performance will go down, and the productivity will go down. So prevention is a very important context, and this is more important and being emphasized more clearly when we look at the current COVID-19 pandemic. Basically, understanding what are the role of prevention, what are the issues that you can use to improve prevention of occupational disease in the workplace is important, so that you would be able to assist and also improve the health of the workers. So what are the natural history of diseases? So basically what we want to know is how does diseases come about. So basically it is when you're a healthy person, all right, and then you have preclinical phase where you have a disease but there's no symptom. And this is clearly illustrated among the COVID-19 patient, where basically when they're exposed to the COVID-19, the SARS-CoV-2 virus, they don't develop symptom straight away, but they become infective. Although they don't develop symptom, these are called preclinical phase, where there's no symptom, and that is where it's important. But there are signs. If you do tests, if you do the PCR test or the rapid antigen test or RTK test, basically you will find the SARS-CoV-2, but they are called preclinical phase because the patient does not develop any symptom. So patient does not know they have a disease, and doctors, when you go to a doctor, and doctor won't know do you have a disease unless the doctor perform the specific test to basically look at it. So clinical phase is where the disease occur, and then when the clinical phase can varies between very mild disease to very severe diseases that actually leads to complication and of course death. So that is what you call natural history of disease. And all of you sitting in this class basically have a chance of getting infected by COVID-19 because you have no immunity against COVID-19 at all. Although we know that after you get infected by COVID-19, the current information we can get is that there are immunity that you can develop, but we still don't understand how long the immunity will last. But there is a immunity response to when you develop COVID-19, when you get exposed to COVID-19. So we have healthy person, preclinical phase, clinical phase, and then complication. So the idea is, what do we do? As I mentioned earlier, disease develop, disease enter the body, but you don't have a symptom, and when clinical phase, that's where the symptom will appears. So it's important for you to understand that. So disease develop, basically disease enter the body. The main thing is about, let's say, COVID-19. COVID-19 is one of the very, very interesting, very simple explanation. But of course, you have other diseases that in the workplace that disease develop, but there's no symptom, like basically like silicosis. Silicosis, asbestosis will take a long period of time to actually develop the symptom, even for noise-induced hearing loss. Although you have early phases of noise-induced hearing loss, because it is progressively it's a disease where you basically, when you're exposed to more noise, the disease become worse. So it is very difficult for people to recognize that they have basically developed noise-induced hearing loss or difficulty in hearing because of the slow progression of the disease. Same like for asbestosis and silicosis, people tend to have no problem with breathing, but when because of their issue of exposed to silicosis, their respiratory rate become worse, and that's why we do what we call lung function test for people exposed to hazard in the workplace that can affect the lung. So some of the hazard includes basically silicosis, asbestos, exposed to silica, exposed to asbestos, or exposed to what we call other kind of dust, like your dust from like organic dust that you can find in a lot of them in Malaysia. So you do lung function tests. Are you clear? Let's go to the next phase. So the other issue we are going to discuss today is occupational injuries. Okay, so definition of occupational injuries is injuries that occur among workers exposed to hazard in the workplace. So what's the difference between occupational injuries and occupational diseases? Basically, occupational injuries, when you develop injuries, you have what we call an incident and history that you have basically get exposed, or you get hurt, or you get into an accident, then you get injury. So injury can be basically both, what we say, there is a loss of function or loss of that means there's an external sign that you have been injured, or there can be just a sign that you are injured because of, let's say, trauma, all right, or let's say low back pain, where you develop where you have injured because you are lifting a heavy object, then you get PID or inflammation on the intervertebral disc. All right. All right. So next we're going to focus on what we call again prevention. So natural history of injury progression is the same problem. All right. Injury develop and symptom appears. So sometimes you have a back pain. All right. Have small injury, and then you develop it and the back pain doesn't occur. So the injury itself, the small injury itself, can be just an individual scenario, or basically it can develop into a severe injury, and that is where symptom appears. So musculoskeletal injury of the low back pain, minor injury causes or joint pain, there's no symptom. Accumulation of minor injury, symptom develop of pain, and then continuation of minor injury, you get disability. So this is basically, although it's considered injury, but we call it musculoskeletal diseases because it is a minor injury where you cannot find a incident that causes a major injury that you need to go to hospital right away. So that's where we call occupational diseases, although it is the occupational injury itself. So, but the main thing is that the difference between occupational injury and diseases is that diseases is basically much more difficult to identify compared to occupational injuries, because occupational injuries, you have a history of a accident or incident, and then you develop an injury, and then you develop a back problem or a other kind of problem. Okay. So levels of prevention. So what type of prevention do we have? Basically, we have health promotion. This is to promote at the level that is basically for people, healthy people, to make sure that they stay healthy. That's why it's called health promotion. Then we have specific prevention, which means that when you are working in a workplace and basically you have identified a hazard, specifically let's say you have done a chemical health risk assessment or a HIRA, and then you identify a specific hazard, so you basically you use the specific prevention to prevent exposure to that specific hazard. And your screening and early detection is where the medical surveillance come in. All right. Even though you have specific prevention, sometimes the chemical health risk assessment recommend you to do screening and early screening. So when you do screening or medical surveillance, that's where you get detection of diseases early on. This is basically not just for occupational diseases, but also for screening of health problems like diabetes, hypertension, and all those diseases. So you can still do screening and early detection. Then only during the clinical phase we institute treatment. Basically, treatment are for two purposes: for to reduce the symptom and to treat the disease. Most of the time is basically we cannot treat the disease unless it's an infectious disease where we can treat it. But for diabetes, hypertension, actually we just reduce the symptom of diabetes and hypertension. We don't actually remove or treat or cure the person from having diabetes or hypertension. That's why those diseases are called chronic diseases, where basically you cannot, or there's no way of you basically treating the disease. You're just managing the symptom. And then we have complication. So basically complication, if you develop, then you need to do a rehabilitation support. So there are rehabilitation services available, and SOCSO also offer rehabilitation services. That's why it is important for you as a safety and health officer in the workplace to be able to identify disease early and report to SOCSO early, so that your workers basically will get the proper management and treatment, because SOCSO offer both health promotion. No, basically SOCSO offers medical treatment for people having occupational disease, and also rehabilitation services. So we have what we call primary prevention, secondary prevention, and tertiary prevention. So primary prevention means prevention before the disease occur. Secondary prevention means prevention of early detection and treatment, and tertiary prevention means to prevent the complication of the diseases, or to reduce the severity of the disease, or reduce the complication of the disease. That's where you go tertiary prevention. So there's primary prevention, secondary prevention, and tertiary prevention. So aim to reduce the occurrence of the disease, elimination of the cause of the risk of the disease. So most of the time when you talk about your hierarchy of control, which is elimination, substitution, engineering control, administrative control, and personal protective equipment, at those period of time basically we focus on is primary prevention. So primary prevention is to elimination or the cause of the risk of the diseases, which is basically carried out by what we call a hierarchy of control to control the exposure to the hazard. Secondary prevention is aimed to early detection of diseases and taking corrective action before clinical manifestation, and also for early management or early treatment. So early detection of disease, what we do is basically doing medical surveillance. So for certain kind of exposure hazard in the workplace, we need to do medical surveillance. Like for noise, we need to do audiometry tests annually, and for exposure to dust like silica or asbestos, we need to do lung function tests or chest X-ray, all right, routinely or yearly. But also there's also other kind of dust that's available, that's present in the workplace, like organic dust from party husks or things like that. So we also need to do regular medical surveillance, which consists of lung function tests and also chest X-ray. Tertiary prevention is aimed to minimize the consequence of the disease already established, and also to look at the rehabilitative process. So it depends on the proper and appropriate treatment. So basically, when you talk about tertiary prevention, is that the idea is that you prevent the disease from getting worse. So tertiary prevention is, when you look at it from a perspective, is if you manage the case disease properly, or you manage your treatment properly, then you would basically prevent the disease from getting worse. Are you all clear? Are you there? Any issue so far? So far we have covered basically what are the what we call the natural history of disease. Then we'll, from the natural history of disease, we discussed to you what is the type of prevention, which is basically primary prevention, secondary prevention, and tertiary prevention. And for each of that, basically for primary prevention, you have health promotion and prevention of exposure to hazard, or specific prevention. Then for secondary prevention is early diagnosis and treatment. For tertiary prevention is to prevent complication of the disease. Are you clear? Any question? Are you there? Sorry.
Yeah, we are here, Prof.
Okay, good. All right. So now we focus on health promotion. All right, health promotion is something that if not you don't get it regularly, it may not be discussed before. But health promotion is a very important component, especially when we are looking at it from the perspective of current COVID-19 pandemic, where although we have a lot of SOP, we have a lot of MKN directive, but many people don't understand what we're supposed to do, how they're supposed to do it. All right. Although we have been doing this for the last 9 months or 10 months, people still not able to get the information clearly. Okay. All right. So this is the process of enabling people to increase control or improve their health. So health promotion is about giving people what we call enabling people to make their own decision, enable people to have the skill, have the knowledge, have the ability to make a healthy choice. This is called health promotion. So Ottawa Charter of Health Promotion idea is it moved beyond the focus of individual behavior towards a wide range of social and environmental intervention. So it's not just on individual behavior, not just telling people to eat better and have better food or exercise more, but also on social and environmental intervention, like providing people places for people to have more physical activity. And then another issue also of providing healthy food in the workplace. All right, so have a healthy choice in the workplace. This is also considered health promotion. So health promotion consists of both enabling behavior change, also having health promotive environment. This is basically to increase physical activity and also to increase access to healthy food. So health promotion is a science and art of helping people to change their lifestyle and move towards a state of optimum health. Okay, even though health promotion addresses issue of lifestyle-related disease in order to reduce risk of related to occupation disease such as occupational stress, smoking, asbestos exposure, and lung cancer. So smoking actually leads to asbestos exposure and lung cancer. So occupational stress is, we'll discuss this when we talk about employee assistance program later, where basically to reduce occupational stress. Smoking is basically a risk for having worse asbestos exposure and also lung cancer. So if you're exposed to asbestos and you're smoking, then your risk of developing worse symptom is higher. So lifestyle change can be facilitated through a combination effect of enhanced awareness, change in behavior, and create environmental that support good health practices. So health promotion in the workplace includes education, organization, economic activities at the workplace that are designed to improve the health of the workers. All right. The management and workers participate on a voluntary basis. So you must understand that health promotion is a voluntary process. It's not like what we look at occupational hazard, where it's mandatory and is governed by certain legislation like the Occupational Safety and Health Act. But health promotion itself is basically a voluntary process workers' participation and joint implementation of agreed program, and to promote better health. These activities are distinct from, separate from activities to meet the OSHA requirement. So you cannot say that, okay, I have done health promotion, I have met the OSHA requirement. That is cannot, is different. OSHA requirement and health promotion is a different thing. You need to focus both on OSHA requirement and health promotion. So when you talk about organization obligation towards safety and health, basically this is from the Occupational Health Services Management, OMHS, Occupational Management of Safety and Health. All right, so you look at it, your legal obligation usually consists of material condition, environmental condition, economic condition, and psychosocial condition. And this is the voluntary, which is your health promotion. So health promotion is a voluntary one, but other things like material condition, environmental condition, economic and psychosocial condition, basically these are obligations that the workplace needs to ensure. Health promotion is just to improve the health of the workers, but we know that by improving the health of the workers, we improve the productivity, we decrease the healthcare costs, basically the medical costs, because the workers have less occupational diseases. Advantage of health promotion in the workplace. All right, why we do health promotion in the workplace, or what we call promotion of which is depends on the site. All right, so health promotion in the workplace, because the atmosphere of peer support and influence, ideal communication environment, because you have workers who basically need to be there and you can communicate through, let's say, your toolbox talk or your roll call, or even to loudspeaker. And also you can have poster everywhere, so it's an ideal communication environment. Able to repeat the message in a variety of form, as I mentioned, in poster form, in a meeting, in toolbox talk, or in roll call. Captured audience, example, easily follow up feedback. Proportionally large amount of spent on workplace, because a lot of time is spent on workplace, so that's why health promotion in the workplace is important. Able to modify environment to suit healthy behavior, as I discussed earlier, that you can modify the work environment to suit healthy behavior, like increase physical activity, like having car park very far away so that you can park far away and then you need to walk, or use of staircase instead of use of lift. And then of course we have basically healthy food in the pantry, healthy food in the canteen. So these are basically, or subsidized for healthy food in the canteen. All right, and also of course healthy food in the dispensing, or so that is important. Be able to modify the environment to suit healthy behavior and changes. So benefit of health promotion in the workplace. A healthy and motivated, well-qualified workforce is fundamental to social and economic well-being. So as I mentioned, discussed throughout the class today, is that if you have a healthy workforce, basically you become motivated and well-qualified workforce is fundamental to our social and economic well-being of the workplace. So benefit to the employers, decrease absenteeism, decrease medical care costs, because we know that most of the employer now provide medical care costs to the workers. So if by decreasing the medical care costs, you decrease your insurance, and decrease your insurance basically increase your profit, and this will benefit the workers. So increase efficiency and motivation, increase company image, and of course increase customer satisfaction, because when your workers are satisfied, the customer will be more satisfied. Benefit to workers, better quality of life, easier modification of an unhealthy lifestyle, and also of course the reduction in stress. So quality of life is important, not just quality of life, because it is important for us to improve the quality of life of the workers, not in the workplace. So when we talk about how do we develop health promotion in the workplace, common success factor of good health promotion in the workplace is looking at individual, involve all stakeholders, which means that we need to do what we call a SWOT analysis, or we need to do an assessment, we need to do of the workplace. We need to assess the current situation, or we need to talk to all individual or all groups who is of interest before we actually start the health promotion program. So based on analysis of health requirement and needs, all right, so we do a situation analysis and come up with what is the current requirement and what's the health needs, because each workplace have different health needs because of the different demographic profile of the workers. Some workplace the workers are older, some workplace the workers are generally younger. All right, so the younger workplaces, we will look at different kind of health promotion. The workplace with an older workforce, we look at different health promotion. Basically, the older workforce, we want to promote healthy lifestyle, like includes to prevent chronic diseases like diabetes, hypertension. But the workplace there's younger population, we want to promote less stress, less particularly less of smoking and things like that. So we know that when you talk about diabetes mellitus, diabetes is basically can be prevented or can be reduced, can be prevented by having healthy diet and also healthy lifestyle. So you can actually reduce your risk or reduce your medication, although you have been diagnosed with diabetes. But if you improve your diet and you improve your physical activity, you basically can reduce the amount of medication. Sometimes you can basically be off the medication, although you have risk of diabetes mellitus. So focus on behavior of individual workers and also become integral part of management practice and daily working life at all levels. So it should be management should agree that you should have promotion, and it's not just what we call a show of that the management is doing something, but also it should be the practice that the management is doing something, and it should be part of the practice itself. Step is developing health promotion program in the workplace. The main important thing, of course, you must ensure your management support. And you must convince the management that health promotion in the workplace is important, and it is benefit, and there is a ROI. So you must develop a return of investment to make sure that the management will provide the funding for you to get involved in that. All right. Establish and coordinate body and steering committee. So a steering committee should be developed, should be established to look into this issue. And steering committee should consist of workers or representative of workers from all various departments. So that basically what you want to do is for them to have a buy-in. All right, and then you conduct a needs assessment by basically doing a situation analysis and need analysis, and you prioritize the needs and develop an action plan, implement the plan, evaluate the process and the outcome, and revise and update the program. So you can basically revise and update the program, looking at it and to ensure that the workplace there is an issue. So these are the 8 steps of developing a health promotion program. So one is important. Any question on this? All right, we'll discuss this further. So steering committee, as I mentioned, steering committee should involve all stakeholders to the plan, monitor and evaluate the health promotion measure. So you need to develop what we call pre-test, post-test. Also, you need to develop KPI, key performance indicator, of whether your health promotion is successful or not. So when you look at key performance indicator, or to evaluate the success of your program, you look at basically a process evaluation, outcome evaluation, output evaluation, and outcome evaluation. So process evaluation, basically evaluate whether your process, you have done it correctly or not. Output evaluation, you want to look at whether how many workers have actually have completed the health promotion program, and what is their input of pre-test and post-test. And your outcome is basically looking at decrease in the risk, decrease in the number of people having diseases like diabetes, hypertension, or decrease in the cost of medical costs compared to before and after the health promotion program. So those are some of the criteria or some of the indicator that you can look at for looking at process evaluation, output evaluation, and outcome evaluation. So need assessment is when you talk about need assessment, we look at health needs assessment, and you can do situation analysis. So analysis of health related information. So where do you get it? So health indicators. So absenteeism due to illness. So the idea is that you just don't collect how many people get absent or how many people get MC, but what is the reason for the MC, and you want to know and you want to analyze the reason for the MC so that you can look at whether we can reduce that exposure or that health indicator. No? The other thing we can get from is that get the number of people having diabetes, number of people having hypertension, and so that we can know that these diseases are important for you to do health assessment. Although we know that some of this health information is basically what we call patient-doctor confidentiality, but they can basically give you the number of people having diabetes, hypertension in your workplace. They can give you the reason for people taking MC in the workplace. All right, so basically that is important. And also the other one is looking at risk factor. Risk factor, basically we look at obesity or decreased physical activity. All right, so obesity is a very simple way of looking at risk factor of people having health problem. So obesity is measured using what we call BMI, body mass index, when it's basically is weight and height. All right, so it's weight divided by height squared. So it's weight in kilogram divided by height in meters squared. It's called your body mass index. So anything between 20 and 25 is considered healthy, and anything above 25 is considered obese or overweight. All right. So health needs assessment. So we need to do analysis of health-related information. Are you there? Sorry, health indicator, absenteeism due to illness, prevalence of diseases, risk factor, obesity. All right. Subjective perceived complaint. So sometimes you can do what we call surveillance to see whether what are their complaints. All right, like what kind of health services is present, or what do they need, and then you can look at expectation of all stakeholders, especially the workers and also the management, and all information should collected systematically and regularly so that you can regularly monitor the health outcome of the individual in your workers, and also focus on improving the health of the workers. So how do you develop action plan? Action plan should be basically, this is as SMART. SMART is not just for action plan, but also for your research proposal. You should be SMART. Basically, look at it. It should be specific. That means lifestyle that could be changed or target population, and you should be measurable. What are the outcome? So as I mentioned earlier, that you need to look at process evaluation, output evaluation. Is basically it's just not enough, but the outcome evaluation is the one that you want to focus on, like your decrease in improve in BMI, improve in absenteeism, improve in hypertension, decrease in hypertension, decrease in diabetes. All right. Attainable, basically the objective should be attainable, like within 1 year or within 6 months, of whether there's reduction in hypertension or reduction in diabetes, and should be realistic. That means the number should be based on analysis, and it shouldn't be too exaggerated and time bound, as I mentioned, that it should be basically 1 year. So when you talk about developing, this is basically looking at SMART, and when SMART is basically your objective must be SMART, and your action plan basically look at it from the SMART perspective. That means the objective must be specific, measurable, attainable, realistic, and time bound. So key concept to health promotion program: to improve quality of life, but focus on individual behavior of individual workers. It also is concerned with it's not just concerned with the cause of ill health, but also focus on good health. What is to promote good health, not just to reduce ill health. And situation, environment surrounding or influence people opportunity to live a healthier lifestyle. So the focus on health promotion is always on not just on behavioral change, but also on environmental change to enable behavioral change. You cannot ask people to change behavior if you don't change the environment, you don't provide the facilities for physical activity, if you don't provide the facilities for healthy eating. So it's not just behavioral change, but environmental change to ensure that behavior will change. So how do you? So that is very important. That's very things that you need to do. So design a health promotion program. Workplace health promotion should be designed to enable working people develop good health and good health-related behavior. Healthy choice should be simple and self-evident, increase in the chances of rejection of what is unhealthy and opting for healthy lifestyle instead. What this means is that basically unhealthy food or unhealthy choice should be more expensive than healthy choice. But currently we know that if you want to eat salad, basically it's more expensive than eating just burger. So salad is, although salad is not expensive or be cheaper, but the problem we need to eat more because we need the fiber and things like that. So the idea is that the healthier choice should be cheaper than the unhealthy choice. So if you have cheaper healthy choice, then basically then you would have workers basically choosing healthy choice instead of choosing unhealthy choice. So program must demonstrate the effective and cost effectiveness of to reduce the risk of disease and promoting health to them and the wide adapted. So the effectiveness and cost effectiveness shouldn't be just looking at cost effectiveness or return of investment for the employer, but also you need to look at focus on return of investment for the workers. So the workers won't invest in your health promotion or won't invest in what you're doing if they don't understand what is the ROI for them. So the ROI should be focused not just on the workers, but also on the workplace. Sorry, not just on the employer, but also focus on the workers also. So your ROI. So that's the importance of ROI. So the type of program that you want to implement depends on the needs. That's why you need to start off with doing a need assessment. All right, and it should be target health problem behavior, so that you can have a you can fulfill your KPI and you can develop the outcome can be attainable. That's why we look at the SMART. So you can basically look at drug and alcohol abuse. If there's drug and alcohol abuse in your workplace, then you must want to look at the drug and alcohol issue. Also, you can look at a whole range of health issue like nutritional, smoking, physical activity, or mental well-being. So the idea is you don't have so many programs to start with. You start with a simple program and then basically with a simple or smart objective so that you can improve on that, and that is attainable. That's where you get buy-in from both your employer and your employee. So the buy-in, the ROI is, as I discussed earlier, should not just focus on employer, but also focus on employee ROI. Why should I invest the time in doing your health promotion, or why should I eat healthy, and how do I basically improve the health so that it's better? So why should I not take MC? Because I'm entitled to MC for 14 weeks, 14 days a year, or 7 days a year. So those are my entitlement. Why can't I take MC? So the idea is that how can you ensure that when health promotion includes, when people don't take MC, what are the benefits for people don't take MC? So those are the things that you can decide on what to do. Event process and outcome, result or impact can be measured by short-term, medium-term, and long-term indication. As I mentioned, short-term, so health indicator like level of relevant risk factor, use of healthy lifestyle program, absenteeism rate, and you can look at economic factor like staff turnover, productivity, cost, and benefit analysis. So your short-term, medium-term, and long-term indicator, your short-term indicator can be both process evaluation and your output evaluation. Your medium-term indicator can be looking at the decrease in the prevalence of diseases and increased productivity. So all those things can be considered long-term and medium-term and long-term indicator. A short-term indicator is both on process evaluation and output evaluation. Look at your process of whether people understand what you're talking about or not, and then of course the output is whether there is an improvement in, at least in the knowledge or attitude of the workers who have attended your health promotion program. Clear? Any question?
No, Prof.
Okay, so example of health promotion in the workplace, prevention of cardiovascular disease. So need assessment. So when you want to prevent cardiovascular, why you want to prevent cardiovascular disease? Why is it important to prevent cardiovascular disease? All right, there's two issues of why is it important to prevent cardiovascular disease. You don't want to have people having cardiovascular disease in the workplace. We don't want people to have myocardial infarction or basically heart attack, and we don't want people to have hypertension and things like that. So to increase the number of increase the health of the people and also decrease the risk of the workplace for basically accident and incident. So if you have a sudden cardiac event where basically the person suddenly fall down and loss of conscious because of a cardiac event like heart attack or sudden heart attack, that is where the danger might be there, and that's where you need to ensure that the health of the workers. So both for this health issue and also for safety issue. So identification of risk factor through screening of obesity and blood cholesterol level. So basically you look at it that, okay, obesity is a problem, blood cholesterol is a problem. So your SMART indicator will be 1% reduction in cholesterol level and 2 to 3 reduction in CVD risk on population basis. So when you talk about cholesterol, is just a specific measurement. CVD risk is basically use what we call composite measurement, just like your risk assessment. So there is a measurement to look at cardiovascular risk. It's focusing on many factors like your cholesterol, smoking status, your blood pressure, whether you're obese or not. So all those things, and also of course your age. And all those are basically looking at cardiovascular risk. So we know that some factors are modifiable, some factors are not modifiable. Age and sex is not modifiable. So the modifiable factors are basically your cholesterol, your body weight, and things like that. So age and sex are not modifiable. So finding that there's higher risk in certain age group or certain sex group, certain gender is sometimes not what we call not useful, because those are called non-modifiable risk factor, and finding that out is basically for you to just comfort that, okay, we would have health promotion for this group of people, but it wouldn't basically improve the situation. So the best thing is to finding out what are the other risk factor that you can reduce the risk for that group of people. Intervention, modification of lifestyle, like changing the healthy diet or increasing physical activity. So health promotion is basically focused on changing diet and increasing physical activity. That is basically more focused towards traditional risks of chronic diseases. But other than that, stress also is an issue in the workplace. So how can we reduce stress in the workplace? So that's also a very important thing for you to focus on. So what do? You can basically have company policy, modification of cafeteria meal to serve healthy meals. All right. Compulsory 10 minutes exercise before commencing work. Sometimes you can do it by making typically looking at how can you improve or increase physical activity. Time and facilities, healthy menu classes, simple and regular update. So this is basically, usually when you talk about time and facilities, you must make sure that those are included in your working time. So aerobic classes during lunch break. So these are so that the workers don't have to sacrifice their personal time to improve the health. But if it's company time, then it's much better. Impact evaluation, short term usage of facilities is provided, long term reduction of BMI and cholesterol, medium term, longer term decrease in prevalence of CVD. All right, so these are some of the this is one example of looking at how to reduce cardiovascular risk in the workplace. Looking at both all the measurement, all the objective and things like that. Clear? So this is looking at both from company perspective and also from if you want to develop an intervention program for your workplace. Also, this is something that you can focus on. So why do we focus on workplace health promotion? Basically, workplace health promotion because it's what we call an ecological model. Focusing on the ecological model, we have a social environment, we have the workplace, the community, the family, the individual. So workplace is basically another environment, another site that you can focus on, because if we can improve the work in the workplace, because the workplace is situated in the general population, in the community, you can actually improve the health of the community by improving the health of the workplace, so that the people actually bring back the healthy lifestyle, healthy issue back to their community, back to their family, and then to improve the community. So these are the ecological model of why do we need the workplace health promotion, and why is workplace health promotion an important thing to consider if you want to do it, if you want to improve not just you can improve not just the health of the workers, you can improve the health of the family and then health of the community, because of the social environment that all of us live in. So this is the health promotion model. So this is workplace health promotion. If you look at it from CDC perspective, it's more like a cycle, PDCA cycle, when you do assessment, planning, implementation, and evaluation. So planning, assessment, planning, implementation, and evaluation. So assessment is look at individual, demographic, health risk, use of services, organization, current practice, work environment, infrastructure, community, transportation, food, retail, parks, and recreation. So what are these available in the community or not? That's why when we talk about providing a healthy environment, we focus on both workplace and also can we do it in the community where the workers are in. Currently, you will know that a lot of our COVID-19 patients actually comes from workplaces, and these workplaces are basically a lot of people stays in hostel or stay in dormitories that is provided by or not to say provided by the employer, but sometimes the employer recommend you to stay in those places. So the idea is that those are the community. If you don't take care of the community, the problem will come back to the workplace, and that's where the issue of community is important. So planning and management, you need leadership support, roles, models, and champion management, work health coordinator committee. That's why we talk about setting up a committee, looking at workplace health promotion improvement plan, goals and strategies, dedicated resources, cost, partners, and vendors. So make sure that all the people are involved, all the people understand what is it. And communication is one of the main setback or main Achilles heel that we have, especially among currently in the COVID-19 pandemic, where the message is not communicated properly, and the message is not communicated. When you talk about communication of message, it's not just information given by the individual or information given by the company through mass media or through social media or through poster, things like that, but also behavior of the management or how the management basically perceive or act based on what they say. All right. So the thing is that we have a lot of lack of management support, a lot of management leadership in the current COVID. That's why the COVID in the world is basically in a bad state because of that. Implementation, programs, education, counseling, policy, example, organizational rules. So you can basically look at it from the policy perspective or the SOP perspective. Basically, sometimes people say, what is the difference between a policy and the SOP? Basically, you need a policy to have a SOP. All right, so a SOP is basically standard operating procedure based on a policy implementation that's agreed upon. So a policy is basically more general, and SOP or guideline or how to work is basically a more specific look at individual policy. So benefit, whether you can give them insurance benefit, incentive of improving health, environmental support, access point, opportunities and physical and social, Evaluation, you can look at workers' productivity, healthcare costs, improve health outcome, and organization change or culture change. So currently we're talking about culture change, like having a healthy culture, but also we're looking at safety culture. Is your company basically focusing on safety or focusing on improving safety or improving safety culture? So safety culture or improving health or improving health culture. So healthy culture. So safety culture and healthy culture. Cultural change is the ultimate that we want. Culture change means that people would, the difference between behavior and culture change is that when culture change, people would basically do it because it is part of the norm. So when you change it to the norm, that's where we talk about this improve in workers. All right. So the same thing when we talk about COVID, this is a new norm. So what is a new norm? And a new norm means that we need to cultural change, that we need to continue in this new norm until the situation become improved. Prevention of work-related disease, behavioral psychosomatic illnesses, hypertension, ischemic heart disease, chronic non-specific respiratory diseases, and musculoskeletal disorder. So COPD is basically one of the main problem when people go back. So hypertension and musculoskeletal disorder. Disease and workplace factor, behavioral and psychosocial illness like stress caused by work overload. Anyone got work underload or not? Anyone got too little work? Sometimes some company do constructive dismissal. What do you mean constructive dismissal? Basically, they give them work that is not according to the workers' ability, or they give them less work until they are so stressed out that they want to change the work. So they're not giving them work to do. They're not giving them any work to do. They just ask them, but they have to come to work every day. So these are basically a way of being underwork. Shift work is a main problem when we're stressed. So how can we reduce the stress for people working in shift? Downsizing has been happening now. Now it's basically more of recession, more working from home. All right. So when we talk about working from home, any of your company have working from home policy? So what do you mean by working from home policy? How can we promote working from home? How can we improve the health of people working from home? How can we ensure that people are healthy? So your work promotion program is in workplace, but how can you duplicate it in the work in the home itself? Lack of career development or role conflict. That means you tell the workers to do something, but the supervisor tell to do something, the management tell to do something, and there's a conflict of roles that the person actually is not able to decide. So hypertension, ischemic disease, stress can cause hypertension. Stress can lead to development of sudden cardiac event, which is basically your myocardial infarction or your heart failure. Exposure to chemicals like carbon disulfide and carbon monoxide also can cause hypertension, also can cause ischemic heart problem or heart failure, because what is carbon disulfide and carbon monoxide? Basically, they decrease in oxygen supply to the system, and then basically when you have decreased oxygen supply, increased cardiac activity, and that's where it basically increase the risk of ischemic heart disease or risk of myocardial infarction. Lack of physical activity because of the type of work that you do. Respiratory disease that can be caused by dust or irritant, or musculoskeletal disease because of ergonomic factor. Ergonomic factor can be lifting is an ergonomic issue, but also sitting also is an ergonomic problem. So is sitting better than standing or standing better than sitting? Which is better? Standing at work is better or sitting at work is better?
Both is equally bad.
Sorry?
Both is equally bad.
Correct, both is equally bad. Why? Basically, it's called moderation, all right? You should sit and you should stand. And of course, sitting, you get back pain, you get low back pain, you get other kind of shoulder pain. Standing, you get plantar fasciitis, or your sole get pain, sole get inflamed, all right? So all those things are bad. So it's basically on moderation, on ergonomics. Is basically not about, it's not about changing or improving ergonomics, but also about time, how long you basically, how long you spend doing the certain thing. So both are equally bad. Very good. Specific protection. Okay, so target on risk group. They can occupational health practices like risk group or for workers exposed to a hazard or prevention occupation disease by controlling the risk or using hierarchy of control. So specific protection is where we basically protect the workers based on the hazard in the workplace. How do we protect the certain workers because of the exposure to certain hazard? So of course the protection is using the principle of hierarchy of control, which is the most effective approach of controlling risk at the workplace is based on hierarchy of control. It recognizes that the best control act on the environment and not on the people. You must understand that the best control is on environmental control and not on individual control, because we know that environmental control is more permanent compared to individual control is based on behavior. Based on behavior is based on what people do in the workplace. So this behavior is a thing. So you need to consider that. So hierarchy of control, we have, I think this is very, very repetitive, and you understand all of this again. Elimination, substitution, engineering control, administrative control, and personal protective equipment. So what is elimination or substitution? So elimination means completely remove a hazard from the work area. The method preferred in controlling hazard and should be selected whenever possible. So sometimes elimination of a hazard is basically not possible because most of the time we substitute a hazard with a less hazardous substance instead of elimination. So when you talk about elimination, is eliminating a process, eliminating an issue itself, all right, a process itself. So that's called elimination of the process. So substitution is basically very simple. We basically replace more hazardous substance is more hazardous substance with less hazardous substance. Like basically replacing conventional material or processes with a less harmful one. Like we know glutaraldehyde is typically used for cold sterilization to disinfect heat-sensitive equipment such as endoscopy, but they can cause dermatitis and asthma. Dermatitis basically is your skin irritation and your skin's itchiness, and then you get scaly skin. Asthma is basically you develop hypersensitivity, and then you get difficulty in breathing when you're exposed to the agent like glutaraldehyde. But sometimes because this is sensitizer-induced asthma, which is important, you understand that sensitizer is an important factor. So when you do CHRA also, they ask whether the chemical is sensitizer or not. Once the chemical is sensitizer, it has a different risk assessment that you need to consider. All right. So what we do is replace the substance with a less side effect, adverse effect that are equally effective in ensuring that the equipment are sterilized properly. The problem is a lot of people don't want to use the new method because they're less effective, but because they cause other kind of problem, like because the chemical used are basically more slippery compared to glutaraldehyde, which is drier, and then it's easier for the surgeon to actually use the endoscopy. Or the endoscopy is basically a scope to put into your mouth to see your stomach, or a scope to put beneath to see your intestine. So glutaraldehyde replaced with superoxidized water, alcohol, pre-acetic acid, chlorine dioxide, quarterly ammonium compound, succinic dioxide, and auto-pentaldehyde. So I think we're using auto-pentaldehyde. It's another form of aldehyde. All right. So glutaraldehyde is an aldehyde. Auto-pentaldehyde is another form of aldehyde. So we are or succinate dialdehyde also is another form of aldehyde. So the thing is that it reduces the risk of sensitization. So sensitization is, if your chemical is sensitization, then it needs special consideration.
Doctor, sorry.
Yes.
What is superoxidized water? Oh, sorry.
Superoxidized water,
Yeah.
not really clear. It's basically some water that contains what we call free radical. So the free radical basically would react with the what we call chemical, not react with the bacteria or the biological agent to kill the biological agent.
Okay.
So that is what, because we need to understand the different, but usually we use this type of oxidized water. Basically, they are very reactive. So when it's very reactive, it become a problem of how to stabilize it and how to use it. But the more stable one, the thing that we use more, basically autopentaldehyde or succinate aldehyde. Basically, it's the same form, it's the same aldehyde, so that's what we use. So each of the substitution chemical you want to use in your workplace, you need to understand what are the benefit and what are the risks, or what are the usefulness, and what are the other things you need to consider. So consider not just as a reduce the risk of the disease, but also whether the effectiveness is there, whether how long the effect is going to be. So the same thing like what we are doing now about the vaccine, correct? We have two vaccines, one coming from Pfizer and the other coming from Moderna, correct? Which is both of them are mRNA vaccine, correct? But one actually you need super cooling, minus 80 degrees, and one you only need minus 20 degrees. So those are the things that are to consider when you want to do a substitution. Not just the cost of the thing, but also how long it's effective and how the storage of it. So engineering control, we know what's engineering control. Usually it's either removing or isolating the hazard through technology. This measure focuses on sources of hazard and pathway of transmission. So by enclosure or isolation. Administrative control is policy aimed to limiting the workers exposed to the hazard and typically accomplished through work assignment. So hazardous procedure of work are scheduled during time of low number of workers, limiting time workers exposed to hazard in the substance, adequate training, and safety operating procedure. So this is typically what we do now among our healthcare worker. You know that, okay, if you're seeing a COVID-19 patient or seeing a patient with respiratory illness, you need to wear certain PPE. You need to follow certain SOP. And we basically limit the number of workers actually going in, limit the number of healthcare workers going into a room where there is a COVID-19 patient, or limit the type of workers that go in, limit the workers so that the workers don't mix with each other, so that when one is exposed, not everybody is exposed. Personal protective equipment. This effective measure to control in the hierarchy of control is always the last option. Reserved for emergency operation. If PPE fails, of course, we know that the condition and quality of workers is failed. But sometimes we need to use PPE, especially in biological hazard, where it's difficult for us to remove the biological. You must understand that when you talk about biological hazard, you cannot do elimination, you cannot do substitution. You can do administrative control and you can do PPE. And sometimes you can do engineering control, but usually it's very difficult because when you talk about biological hazard, because it's a hazard, is not a substance that you introduce. So biological hazard is something that you cannot do substitution and elimination. Screening and early detection. So what's screening and detection? Is to detect the early sign of the disease. So when you talk about screening, so when can you do screening? When should you do screening? When do you do medical surveillance? Basically, when you only do screening and medical surveillance if there is a sign or a measurement or a factor that you can identify for you to basically know that there is the disease, there is the exposure, the workers has been exposed to it. So you don't do screening just because you want to, and then by the time you do a screening test and after that you don't understand where the person actually got the disease from, whether it's from your workplace or from other places, or whether there is the disease or not. So that will basically increase the cost of your management, increase the cost of your it would affect your reputation of whether you are capable or not. So when you do screening tests, when you approve a screening test in your budget, you must know that whether the screening test actually detect the hazard in this workplace or not, whether it is important or not. So medical surveillance is a form of screening, all right, but medical surveillance is specific screening to a specific hazard. So you must be exposed to that hazard before you do the medical surveillance. You don't do medical surveillance for everybody, then if you get some findings, it's very difficult for us to interpret the finding because we don't know where's the exposure. Because we know that the exposure can come from the workplace, also the exposure can come from the non-workplace. So medical surveillance is only for workers who are exposed to that hazard, workers working with that hazard. Screening is based on hazard and exposure. And also, of course, screening also, we look at screening for us to basically look at whether we can do medical removal protection. So what is medical removal protection? Is basically to remove a person from the workplace so that they can recover or the hazard can reduce because of the hazard in the workplace. All right. Because by the time they're removing the hazard, the list will come down. So this one has been discussed earlier in your toxicology. Remember or not, we talk about half-life. So when the chemical half-life, that's how long we need to remove the workers so that the chemical can come back to normal so that it wouldn't affect the workers anymore. Prevention of the establishment of the disease is where you do screening. All right, so we know that this is what we call screening and early detection. So this is the iceberg theory. Iceberg theory is all used constantly. I think sometimes we use here also. Iceberg theory means that what you can see is only the top of the iceberg. What you cannot see is basically at the below of the iceberg, which is much larger. That's where you got the preclinical phase. So when you do screening, basically you'll be able to identify more of things below the iceberg, so that for you to ensure that you are safer, and not just looking at above the iceberg. All right. So again, it's called symptom and no symptom. So after screening, you basically what you do what we call disability limitation, aim to have proper diagnosis and treatment and occupation disease, can prevent appropriate treatment and expensive unnecessary healthcare, can lead to prevention of disease and other workers, example, eliminating and reducing hazard and exposure. Workplace important is given to appropriate compensation and of the workers. So you must, when you talk about identifying occupation disease or work-related disease or work-aggravated disease, the important thing is when you identify something, you must also see what are the benefits that the workers actually can be given based on what they are exposed to. So that's also very, very important for you to focus on. The diagnosis of occupational disease, history and investigation will trace the causative hazard and their exposure to workers. Easy if illness result occur like acute traumatic injury, as I mentioned earlier. When that side, if you just lift and then you get back pain, you know that the lifting leads to back pain. But if it's a chronic disease, chronic ergonomic disease, chronic musculoskeletal disorder, it'll take a longer period of time. Then it's very difficult to diagnose whether it's occupational or not. The most problematic one is basically of all your respiratory diseases, all your silicosis and asbestosis, where you take a longer period of time before you get the diagnosis of that disease. Rehabilitation is discipline assessment, return to work program, and compensation. So that's where you do rehabilitation. So rehabilitation is first you want to look at whether the fellow can go back to work or not, whether the fellow, what is the disability status, and then you develop a return to work program, and then also you say whether you need compensation or not. So we know that SOCSO support both disability assessment and return to work program. So involving SOCSO early on is very important. And SOCSO currently now have what we call case manager, which basically manage the cases of the issue. Justification of intervention. Okay, is work restriction result in a better health outcome? Is return to work duty safe for patient will return to unhealthy condition or re-exposure? Will patient lose income or incur additional medical expenses if not, and hardship if not, they don't return to work, or they return to work also? Has the work site been modified to allow a safe return to work or return to duty? Has a degree of impairment adequately addressed? So these are the things that we consider when we basically before we actually whether the person can return to work or not. So this is what we consider when we look at the patient's return to work. So is the work restriction result in a better health outcome? Is return to work duty safe, or the patient will return to unhealthy condition and re-exposure? So basically, when we talk about medical removal program, we don't just remove the person from the workplace to reduce to allow the chemical to come down, but also we ensure that we entertain or we modify the workplace to reduce the hazard in the workplace. So without the modification and reduction of hazard, the workers actually cannot return to work. So that's important. All right. So will patient lose income or incur additional medical expenses or hardship? All right, and also has workplace been modified that allows safe return to work and has a degree of impairment adequately be addressed. Compensation is last but is not the least. Usually provide workers with lost wage and medical expenses. Issue of temporary and permanent disability requires through documentation of medical findings that support medical conclusion. The level of impairment and description of quality, the effect of disease and ADL. Conclusion: prevention of occupation disease and injuries encompasses all levels of disease spectrum. Each level of prevention handles different target group. This is to ensure that they protect not only the health of but also the welfare of the workers.